arm now, and we're going to take a look at the muscles that are found in the rotator cuff region. Okay, the first one here is number 6. This muscle here is going to encompass the convex side of the scapula. Big muscle here, what muscle is that?
Subscapularis.
It is the subscapularis. It's this entire muscle that we're seeing here, okay? This entire thing, one of the sits muscles, right? Subscapularis, okay? Then we have number 9. What muscle is this if we look at number 9 right here? And its position and its relationship to another structure. What do you guys think?
Pectoralis minor.
Minor, okay? It's cut. So the pectoralis minor kind of goes over this way. It overlies this point right here. And this pectoralis minor is going to kind of overlie your major axillary vein. Sorry, not vein, nerve and artery. That's right here, okay? That structure right there. That muscle's going to be found there. Overlying this is what muscle? What muscle overlies the pectoralis minor?
Pectoralis major.
Kathy, go. No? The pectoralis major. Yes, go. The major, right?
I'm a cameraman.
The pectoralis major. So you want to have that relationship in mind. What about this guy right here, number 8?
That's the
So if we look at
latissimus
that is
dorsi.
the latissimus dorsi muscle. Its origin is going to be on the humerus, and that's the one that gives the posterior axillary line. So you know the back of your armpit? You know how you have a front of the armpit? The front of the armpit is made by the pectoralis minor and major. The back of the armpit, it's the latissimus dorsi. Okay, so you know it in reference. Okay, so these are these muscles here. Now I have number 17. 17, if we turn the arm this way, okay, we're going to see this muscle start from this point here and kind of go into the brachial region. Any guesses? The coracobrachialis.
Brachialis.
Why? Because it originates in the coracoid process of the scapula, and it goes all the way into and it inserts itself into the brachial region. So this one here is called coracobrachialis. Okay? So these are these muscles that are found here. Okay? Now if we look at this point right here, this large, fleshy, triangular muscle. You guys see that? Triangular muscle. What muscle is that? It's our favorite muscle for something. For injections, right? The deltoid. There's an anterior, there's a middle, there's a posterior portion. I forgot to tell you guys, when you guys work out, there's different ways to work out the deltoid muscle. So you have a nice look to the deltoid. So you have, those lines, those striations that you see some people have when they flex the deltoid. When they're cut? Yeah.
What I don't have.
Well, they're cut for that reason because they're working out the anterior, the middle, and the posterior part of the delt. So when they flex, you can see those striations and it looks pretty cool. Okay? And then as they do flex downward, because it inserts itself into these other arm muscles, it becomes very prominent. We can see the deltoid. For us, clinically, it's a favorite muscle because it's large, it's fleshy, and there's no real major nerves that pass through here. So easy to give an injection if you're a newbie, if you're a rookie, if you don't know how to do this, and you're not going to hurt the patient. Okay? So that's the deltoid. All right, now if we go to the posterior side of things, we're going to have some other muscles that are going to be found on the scapula, like we said before. So if this is the scapula, if we look at the scapula this way, right? We know this is the scapular spine. Go back to your bones lecture, right? Scapular spine. So things that are found above this line, what do you think we would call that muscle right there?
Superior.
How about supra?
Supra. Supra.
Not supra. Supra.
Oh, supra.
It's above the spine.
Supraspinatus.
Supraspinatus. You guys understand the reason why it's called supraspinatus?
Yes, because
Supra above.
this.
Spinatus because it's above the spine. Supraspinatus. Does that make sense? So what do you think number 11 would be? If it's below the line. Infraspinatus. Does that make sense? Supraspinatus, infraspinatus. Or say it's infraspinatus. Well, Latin, infraspinatus. Well, it's infraspinatus, same thing. Infraspinatus. So do you see that one here? Infraspinatus, supraspinatus. Okay? And then we have this other muscle right here, which is this guy right here, number 12. Look at that guy right there. Which one is that one? That's the teres minor. Teres minor. Why? Because like we said before, what are the sits muscles? S-I-T-S. We just reviewed them. Right here. Subscapularis, you said? And you said supraspinatus. Well, let's go in order. S, I, infraspinatus, supraspinatus, infraspinatus, teres minor, subscapularis. S-I-T-S. Okay? So which one is not part of the SITS that always throws people off? It's this guy right here, which is the teres major. Do you guys see what this guy right here, number 13?
13. Okay.
There it is hidden in the
Teres
back.
major.
That's the teres major. That is not one of your rotator cuff muscles. You guys see how it's not a rotator cuff muscle? Because it's nowhere found on the head of the humerus. It's not right here, on the scapula, I should say, sorry. It's down here, okay? So it's not a rotator cuff muscle. So we've conquered the anterior, the posterior regions of the shoulder, right? And some muscles in the arm. Let's go to let's stay with the posterior. We've got a number right here. We've got a big muscle that's found all throughout the posterior region here. What muscle is this one here? 3 heads.
Brachii.
Triceps brachii. Again, brachii, why do we call it brachii? Because we're dealing with the brachial region. So a lot of the terminology, biceps brachii. Why do we call it the biceps brachii? Brachial region. Okay, so this is the triceps. Why? 3 heads. Okay. On the posterior compartment, we've got this little triangular muscle that's found right here that's going to be used as a synergist, right? Which is, what's the name of that one?
It's number
Quick.
17?
No, 47. That's the anconeus. Anconeus. The anconeus. These are the only 2 muscles that are found in the posterior region of the arm. Okay? There's no other muscles found in the posterior region. So did we conquer the arm posterior? Okay. Not forearm, but arm. Now let's switch him over. And now let's take a look at the anterior arm itself. Okay, so the anterior arm, we're dealing with the major muscle that we get to see, right? Everybody loves their biceps, right? Well, I gave you the answer, but this is the biceps, right?
Yes.
The biceps brachii. It's a superficial muscle. We call this guy the show horse. Why? Because everybody likes to show it off and say, look at my bicep, right? But the actual muscle that does the work is the one that's underneath the biceps. And this muscle here is called the, don't look, BBC. So biceps. One isn't. We just talked about the coracobrachialis. Okay. The brachialis.
Okay.
The brachialis. So the brachialis or brachialis. This is the workhorse. If the biceps is the show horse, the workhorse is the brachialis.
Okay.
So this is the one that looks good, but this is the one that actually does the work.
So this is the core.
This one right here, coracobrachialis. So
This is
the little mnemonic,
Just brachialis.
brachialis. So BBC,
BBC.
right? The BBC. Quick little mnemonic. BBC. These are the muscles that are located in the arm.
Okay.
Make sense?
Yes.
Okay. Okay. So that takes care of these muscles here. Yeah.
Yes.
Okay. Now let's go to the forearm. So in the forearm, we've got flexors and we have extensors, right?
Right.
Okay. So how do we know which ones are flexors, which ones are extensors?
Because the flexors.
The flexors are going to be
come-
anterior. So when you do this, you're flexing anterior. Extensors, you do that, they extend. So posterior. So anterior flexors, posterior extensors. Right? So we're looking at the anterior. So everything here is going to have something called a flexor at the beginning or the end of it. Right? Okay. So let's start with the superficial muscles. So there's a muscle right here. This one right here is a very important muscle. It's going to form part of your cubital fossa in your forearm, number 28. And this one right here is going to assist in the movement of your arm from anterior to posterior. Do we know what this muscle is called?
Supinator. No.
No?
Pronator.
Pronator?
Pronator teres.
Teres, or teres, okay? Pronator.
Pronator.
Pronator. Supination is up, pronation down. So this is the muscle that's going to allow you to pronate.
Sorry,
right?
guys.
Not supinate, pronate. Don't listen to Kathy. Listen to Dr. Cohen. Okay? So this right here, we call it the, go for it now.
Pronator teres.
Pronator teres. That's 28 right here. Okay? And number 27, this one right here, what do you think this was called? So it's up here, and then it extends all the way down into the wrist.
Brachioradialis.
Very good. Perfect. Brachioradialis. Because we're originating from where? The brachial region, and it's going all the way through the, again, radial bone underlies this, brachioradialis. Okay? And this muscle here, the significance, again, it forms the lateral aspect of the cubital fossa. So when you look at a patient, you can see that there's a certain markings in the cubital fossa. Okay? So this part right here is going to be which muscle, like we said?
Pronator.
Pronator teres. And this one on this side?
Brachioradialis.
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 Brachioradialis. Okay? And again, the significance of that is what? These guys right here. The veins. Because those veins right there are important for you guys as clinicians because that's what you're going to be drawing blood from. So you have to know what the musculature that overlies these regions right here.
Okay.
Is there an issue with veins, nerves? More on the medial aspect of it and deep. So it's very hard to hit these nerves.
Right.
Not common to hit those nerves. You're going to hit veins that are going to be found in this cubital fossa. So we got these 2 muscles out of the way.
Would you irritate the ligaments first versus the nerves?
Yeah, yeah. in those instances of trying to draw blood. We should ask Angel. He knows. 29. What's this guy right here? So this is going to be a long one. It looks like it's passing through something, and it's entering the. It's overlying the radial
So
bone.
Is it
It's flexor.
Of course, it's a flexor.
carpo radialis longus?
Flexor carpi radialis. Why flexor? Because we know where we are,
Is it
anterior. Flexor carpi
radialis.
radialis. There is a longus.
No.
There is a longus and a brevis.
Yeah.
Okay.
There is a longus and a brevis. Yeah, this would be the longest. The brevis is going to be, I think, 32, which is going to be this one right here.
That's the carpi radialis brevis?
Yeah, I think that's a flexor. Just double check that one.
32.
Yeah,
Oh no, it's flexor digitorum superficialis.
flexor digitorum superficialis. Yeah, because if we go down, this one is the flexor digitorum profundus. Okay, so this is the flexor digitorum superficialis. This one again was what? If we're talking about the flexor
The flexor
Carpi.
radialis.
radialis, because again, think about where it's going. Where's it going?
To the wrist.
To the wrist. So how do we say wrist?
Radial.
No,
Radialis.
wrist radialis, not radialis. Carpi.
Carpi.
What bone is it overlying? The thumb, the radial,
Okay.
the radius.
Okay.
So flexor
Carpi.
carpi radialis. Okay. This guy right here, number 30. Look at this one here. This is a long one that extends from the forearm all the way down into the palm.
Palmaris longus.
There, yeah, it's a long. I told you guys the clues. It's a long muscle that goes through the forearm into the palm. It's the
Palmaris longus.
palmaris longus. Okay. So what do you think it helps do? What do you think it does? It's going to help flex your. There you go. You see you're flexing right there. Those right there. Those are the tendons that you're seeing right here. Okay. You should see when they're cut. When they're cut, it's pretty cool to see there
I
is
always
this.
just think those
Yeah.
are bones.
No, those are. Well, now you know.
I'm not gonna lie, me too.
Yeah. No. Yeah.
I was like, these whistles.
Yeah.
Touch this.
My bones feel. Yeah.
They're
Yeah.
weak.
No. You need to work them out. But again, yeah, palmaris longus. Why? Because it's a long. Remember, all these muscles here, where are they originating from? If this is the epicondyle of the humerus, do you guys remember that? They all kind of originate from this point. Okay, which makes them easy to remember. Okay, then you have this one down here at the very end. I'll give you a hint. The ulnar bone underlies this. So what do you think we're dealing with here?
Ulnaris.
Flexor?
Flexor ulnaris.
Flexor carpi ulnaris.
Flexor carpi ulnaris.
Did we have a flexor carpi radialis?
Yes.
Because it overlied a radial, the radius,
And
the
this
bone.
is 31.
And this is 31, so this would be the flexor carpi.
ulnaris.
I mean, look where the muscle goes, right into the carpal region. So flex, what's it do? Flexes. Flexor carpi radialis?
I mean,
ulnaris.
Ulnaris. Why ulnaris? Yeah. Why ulnaris? What bone underlies this? Ulnar bone,
Ulna.
right? Just remember your anatomy, your bones. You know that.
Yeah.
Radial. Do you see that guy right there? This artery? What artery do you think that is? It's the radial
Radial
artery.
artery.
Because the radial bone underlies that. That's when you check your pulse. That's what you're looking for. Okay. Where is it in line with? Your thumb.
Mm-hmm.
Okay. You guys see that? So did we kind of understand the anterior compartment more or less? Superficial?
Yes.
Let's continue. Let's
go
go
deep.
deep now. Okay.
We're diving in.
Let's go in. So now we have other ones to take a look at. So you guys told me earlier 29 was a flexor. Flexor, what was it again? Flexor?
carpi radialis.
Flexor carpi radialis. So what would 32 be right here? Oh, we can see it here as well. I think we talked about that. Flexor,
Digitorum superficialis.
flexor digitorum superficialis. You're seeing a little bit here. If you notice, this is the superficial region. You're seeing it kind of peek out here, but if we were to resect these two muscles, you'd see more of it on the inside. You guys see that?
Yes.
So this one right here would kind of run through here.
Okay.
So this is the flexor digitorum superficialis. You guys see that? Superficialis. So when you hear the term superficialis, that's got to tell me something.
It's
It's got to tell me
superficial.
superficial. That means there's got to be a deep somewhere. No? So where do you think the deep is?
Right here. No,
it-
right here.
Right, yeah, there you go. 33. What is 33? Should be flexor. Yeah. 34. Flexor digitorum profundus is going to be this one right here, flexor digitorum profundus. Because remember, we're talking about this muscle that's overlying. If we underline this muscle, look where it's going. I want you guys to follow it right here. Look, flexor. Look what it's doing. Where's it going? Flexor digitorum profundus to the digits. So it's got to be this one here. This one right here is going. If you follow it, it's going to go to the thumb.
Pollicis.
Pollicis.
Yeah.
I think longest. No. Longest. Yeah.
Flexor, pollicis,
Look how long this
longus.
muscle is. Is it long?
Yes.
Yes.
To go to the yeah. So what's it do? It's a flexor. Where's it going? The thumb. Flexor, pollicis longus. This one next to it. Don't confuse this one. Look again. Where's this one going? It's going to the digits. So flexor digitorum
Longus.
profundus.
Profundus.
Because we just talked about the superficialis, which was 32.
Okay.
So
Profundus is like profundo.
profundo, exactamente, es latín, es español. So si puedes hablar español, es igualito, ¿no? So just put a little Spanish twist on it y profundo, profundus. Superficial, superficial, ¿no? Largo, long, no longest. How do you say short or no? Brevo? Brevo? No, never mind. That doesn't fit. Okay, so far so good, right? We talked about all these. All right. Oh, what is 35? This is an important one. It's not the artery, but it's the muscle.
Pronator.
It's going to be another. It's not the pronator. Yeah, it's not the pronator teres, which we saw up here in the forearm.
Right.
This is the pronator quadratus. Okay. So that's going to assist us to do what? If you look at yourself pronate, what do you do when you pronate? Look at your hand. You're going up here. You're moving this stuff up here, and what else are you moving? You're moving this stuff down here. So
Right.
as you pronate, look what's happening. You guys see that muscle right there? That's the part of the pronation that we're seeing. So pronator quadratus. That's what's happening there. Now all you're seeing on your videos like this hairy guy's in his arm.
This is the hairy guy in the video.
At least hairy arms everywhere. Like, what is that monkey teaching?
Jesus.
So hairy. Tell him to get a haircut. So far so good. Quadratus. No, sorry, not quadratus. Pronator quadratus. So far so good, right?
Yes.
We're on point. Awesome. Now we're going to remove this guy right here. We were talking about these ones already?
Yes.
Yes. Okay, so let's well, not really.
No.
We didn't talk
no,
about
we didn't actually.
Let's talk about 40, what is that? 42 and 43. So if we look at these muscle groups here, now we're moving more towards the posterior compartment, okay? So these guys right here are now part of the posterior muscle group. So what do you think we're going to call these guys?
Extensor.
Extensors. So what do you think 43 is?
Carpi radialis.
Extensor carpi
Extensor
radialis.
carpi
brevis.
radialis. Because again, look where it's
not
going.
brevis.
I don't know if is it a brevis or
One is
longus?
brevis, 43 is brevis.
43 is brevis?
Uh.
Well, it makes sense. If it's short, I mean, let's first talk general. Both of these are going to be extensors. Extensor, carpi radialis. Did we not have a flexor earlier? We talked about a flexor
We did.
carpi
Yeah.
radialis.
Yes.
So it's the same in the posterior side because the posterior side is going to do the same, the reverse action.
Right.
So it's going to be the extensor. Again, where are they going? The wrist. Carpi. What bone are they overlying?
The
Radialis.
radialis.
And then, of course, there you have the brevis and the longus. If you look here, this one's kind of short.
Yes.
Brevis. This one's kind of long. Longus.
Skinny one is a long one.
The skinny one is the long one because it's a little bit longer, if you follow, versus this one right here. Right? Does that make sense?
Yes.
All right, so we're done with these two, yeah?
Yes.
Perfect. Okay? And there's no muscles that are deep. These are just two thick muscles that are together. Now we're on the posterior side deep. We've got 48, 49, and 50. Okay, so these muscles right here sometimes cause a little bit of difficulty for students. What do you think 49 is? No, sorry, 48. 48. So
Supinator.
this muscle right here, if you remember, we had a muscle on the anterior compartment that's going to allow me to pronate. So the reverse of that would be what? Supination. So on the posterior side, I've got to have a muscle that's going to allow me to turn back.
Right.
Right? So what's that muscle that's going to allow me to supinate?
The supinator.
The supinator, right? It makes sense. So where's that located? Look at the reference, the anconeus. It's the muscle that's deep to the anconeus, if you want to look at it that way, right? Right where the elbow joint is going to be at, the opposite side of the inlet of the elbow or the eyelet of the elbow, you're going to have the
Supinator.
supinator. So very important muscle. You see how big it is?
Yes.
It's a very big muscle in the deep posterior region. And then 49 and 50. These two guys right here sometimes cause a little bit of confusion. Look where they start, look where they're going, look where they end up. Where are they going? The thumb. There's one and this one too. Look where is it going?
The
The
thumb.
thumb. So what do you think these are?
Pollicis.
Very good. One is
wasn't
probably going to be
in
a
the regular?
flexor, and one's probably going to be an extensor and abductor.
Okay.
So which one is which?
49 is abductor.
49 is the abductor. So what is this muscle going to do? Abductor.
Abductor.
Abductor. It's going to allow you to do like the number 5, abduction. So when you do number 5, like give me a high five, the the abductor pollicis
Mhm.
is the one that lets you to spread out and do the 5 finger. Yeah, away. Okay. If we talk about 50, what do you think 50 is going to be?
Extensor.
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 pollicis.
So this is the one that's going to allow you to kind of do this movement, like a thumbs up.
Okay.
Okay. Does that make sense?
Yes.
So again, if you follow their pattern, not their pattern, but their flow, where do they go? The thumb. Okay. Pollicis. Right.
Yes.
So far, so good. Those are all the posterior ones I think that we're gonna ask. I think all
How
these
about these?
reference. I think those reference what 50. I don't think I asked that one. But what is that? Is that a vein? I don't know what that one is.
52?
52. I'm not sure about that one.
It's the extensor indicis.
Extensor indicis. So 52, if we were to follow the pattern, would probably go this way. It'd go under the flexor retinaculum and then go into the index.
finger?
So this is the one that allows you to point, basically, your pointer finger.
Okay.
But I don't think I asked that one.
Okay.
What about these guys right here? What do we call, I think this is 77, the muscles that are found in the palm of your hand. What are those muscles called?
Dorsal.
Dorsal, yes.
Interossi.
Interossi. They're in between the bones. Ossi bones, yes? So they're in between your digits, the interossi. What is the function of these interossis? Do you guys remember? Is it abduction, adduction?
Both.
Both. Because you have, if you have dorsal interossi, do you think you're going to have palmar interossi?
Yes.
Yes. And they're going to allow you to abduct and adduct.
Yes.
That's their
both.
function.
Yes,
yeah.
because they're the striations.
Mhm.
The striations.
The
are
striations.
going-
Yeah, very good. You see the
Okay.
striation patterns, the
Mhm.
way they're running?
Mhm.
They're going to allow you to open up and close. Or we're going to say abduction, adduction.
Okay.
Right? Make
Yes.
sense?
Yes.
Okay. So now let's go back to the anterior side of things. Let's go a little deep. We've got 58, 59. Again, these are going to be part of your thenar or hypothenar muscle group.
Hypothenar.
Mm-hmm. Hypothenar. Do you guys remember the hypothenar is the thumb? The thenar eminence is the little finger, right? So these are going to be thenar. So we're going to be looking for digiti minimi or
Mhm.
minimi, and we're going to see pollicis on this side.
Okay.
So what do you think 58 and 59 do?
Abduct.
This one's going to
Abduct. Yes.
abduct or adduct?
Adduct.
Abduct.
Abduct. What about 59?
Adduct. No. The same?
Flexes.
What are they? What is this?
They're
58 is abductor. Pollicis. Brevis.
Uh-huh.
59 is flexor. Pollicis. Brevis.
Flexor? Okay.
So this is an abductor and this is a flexor?
A flexor. Okay?
Okay.
So it allows you to do this motion.
So this
Flexion.
is the pollicis abductor?
The adductor pollicis.
Abductor pollicis.
Abductor pollicis.
And the flexor pollicis.
Flexor pollicis. So this one's allows you to do this. Flex.
Okay.
This is flexion of the digits. Okay? And then, of course, you've got your palmar interossi that we're seeing there. That's 61, I think, is the palmar interossi.
How about this? It's the same thing?
I think that's going to be an artery.
Ah.
They're talking about the
They're
arteries. that are
labeling an
formed.
artery.
Yeah.
So all of these are interossi, the palmar interossi.
Yeah, all these muscles that you find in between them, they're the palmar interossi muscle group. Because remember, in the fingers themselves, there's no muscles. If you
Right.
notice, they're all tendons and part of the flexors that we're seeing. No muscles are found in the fingers. And then we have the last little part right here, which are the deep ones.
But wait, there's
more. Oh, I think one important one is 71. This one's tricky because you think it's going to go to this finger here, but if you see the pattern, where is it running to?
To the thumb.
To the thumb. So what do you think the muscle here does?
Adduct.
That's the adductor.
Yeah, the adductor.
See?
Okay.
So
yeah.
we had the abductor,
Abductor,
here,
the
and then
flexor.
deep. Yeah, the adductor.
No, the extensor, the abductor,
abductor.
the abductor, the extensor, and then the
adductor.
adductor.
This is the one that's going to allow you to do number 4.
Okay.
Adduction. This one right here.
Mm-hmm.
Okay? Because you see the pattern the way it's running to the thumb to allow you to do this. 4. Make sense?
Mm-hmm.
And I think those are all the muscles that we're going to see.
Wait, are these all?
Nope. Time's up.
The lights
Move
went
around.
out.
Is that working?